Well, hello there, beautiful mom. Welcome to the second trimester. This is usually a lot of moms' favorite time in their pregnancy because nausea starts to ease up. All that nasty first trimester symptoms starts to ease up. A lot of women say they start to feel better during this time. They start to feel like themselves again. And then there's a lot of evidence now that you are actually pregnant in this trimester. Great fun time. You get to see baby on the ultrasound. You get to style your bump. So exciting. I'm Ade Tutu, your women's health nurse practitioner, here to walk you through the weekly updates on what's going on with you and baby each trimester. Today, we are going to focus on the second trimester, and that's weeks 14 to weeks 27. So get comfortable, grab some tea, some coffee, some water, some snacks. Let's dive into it. Week 14, baby is about the size of a peach. The average size is about 3.4 inches long and 1.5 ounces. Baby is about the size of a clenched fist. Amazing development this week. Baby is covered in lanugo, which is fine, soft hair that's meant to keep baby warm. Don't worry, most of this would disappear before birth. Baby's liver and spleen are doing their job. The kidneys are making urine beautifully. Baby is also developing the roof of their mouth, and their fingerprints are now starting to form. And for you, mom, although you might be feeling great during this week, the HCG level is decreased, you're getting some energy back. There are still some symptoms that may not be as bad as first trimester symptoms, but there are new symptoms that can come about. One of them is constipation. Now, the reason is because your uterus is now expanding, which can put some pressure on your bowels and can cause you to have a harder time going to the bathroom. And another one is because of the progesterone hormone. Now, this can cause your muscles to be relaxed. We love progesterone, but it can cause relaxation of your muscles, including your digestive tract, which makes it harder to go to the bathroom. So drink a lot of water, eat fiber-rich foods, get your walks in, stay active to help you with that constipation. Week 15, baby is about the size of a navel orange. Baby is about 4 inches long and weighing around 2.5 ounces. Their legs are finally longer than their arms and they are moving like crazy in there. Now at week 15, you're probably not going to be able to feel these movements yet, especially if this is your first pregnancy. At week 15, baby is sucking their thumb and practicing their facial expressions, making funny faces, and they're possibly starting to sense light as well. So although their eyes are closed, they can sense light. And baby's earring is also now start to work as well. So this is the perfect time for you to now start talking to baby as they now can start to hear you. For you, mom, watch out for nosebleeds. Nosebleeds are a possibility because of that increased blood flow that happens during pregnancy, okay? You get an increase of about 45% of blood flow to help you with your pregnancy, and this can cause you to start having nosebleeds. Pay attention to them. Again, remember to pinch your nose, not tilt back. Pinch your nose to stop bleeding. And if it becomes too frequent, make sure that you speak to your provider. An important marker this week. This is the week that a lot of your providers can start to have multiple marker screens. This is the blood test that is checking for baby's risk for certain conditions. Some women might also have amniocentesis if recommended. Week 16, mom, you are officially 4 months. And baby is around the size of an avocado. Baby can weigh up to 3.5 ounces and as long as 5.5 inches long. For this week's development, baby can now start to hold their head up. And also baby's facial muscles are getting stronger. So now they're able to smile, frown, squint, and make different facial expressions, okay? And then baby's tiny bones in their ear canal is also forming as well, which means that baby can actually now start to hear you a lot better. Last week, baby was starting to hear voices. This week, baby can hear you a lot better because of this. Continue to talk to baby so baby can eventually now start to recognize your voice. For you, mom, some more changes that could possibly happen for you. Your breasts can now start to grow a size or 2 up thanks to those hormones. 2, your joints can now start to hurt simply because, again, of that relaxation that happens with your joints that can cause you to start having back aches. So look for back support braces that can help you with those aches. And exciting news, your belly is probably popping now, whether it's your first pregnancy or whether it's your fourth. You should be able to see some sign that there is a little one in there. Week 17, your baby is about the size of a pomegranate, up to 6 inches long and 6 ounces. Big moment, mom. This week, you may start to feel little flutters that feels like little butterflies in your stomach. So exciting. So if you're a first-time mom, you may not feel this yet. If you've been pregnant before, you may start to actually feel something that feel like butterflies in your stomach, like little flutters. It's the cutest thing. It's called quickening. For baby's development, more ear development. Baby's ears are moving to the right position. They're able to hear better this week, so continue to talk to baby. Baby's skin is stretching. The big one for baby this week is baby can start to actually get hiccups, okay? It's a part of normal process for this development, but hiccups are now starting to happen for baby. For you, mom, it's time for you to shift from sleeping on the back to now sleeping on the side, preferably on your left side. And the reason is because you can possibly be squishing a major blood vessel, okay, that actually sends blood to baby. So if you're sleeping on your back, it can cause the blood that's going to baby to decrease. If you're a back sleeper, mom, it's time for you to put those pregnancy pillows to use. Those pregnancy pillows, oh my goodness, they are the most annoying looking thing, but they're going to be your best friend. So you might as well start using them now. They're going to be your best friend from here on out. So what you want to do is place one of those pillows, place it under one of your hip to tilt you away from your back, okay? Kind of still gives you the illusion of sleeping on your back, but you're actually sleeping on your side. That major blood vessel is not going to get compressed as long as you slightly move your body, okay? Week 18, mom. Your beautiful baby is now about the size of an onion. And such an amazing milestone this week. Baby's brain is maturing rapidly. Baby is developing a substance called myelin. And simply what it does is just allows messages to be able to transfer between cells. All right. So now baby can really hear you. So get to talking, get to singing, get to chatting, just talk to that beautiful baby. Oh, mom, your uterus is growing now. Your uterus is now slightly below your belly button. So your baby bump is showing for most women now. So exciting. But still a little cute little bump, but it's just now start to really show that people are like, oh, so that's a baby. You didn't eat 2 burritos? No. Okay, that's a baby. Although if they ask you if you know you're pregnant, it's still kind of rude. I still think it's rude to ask somebody if they're pregnant. What do you think? What do you guys think? Do you guys think it's rude to ask somebody if they're pregnant? Have you ever asked somebody if they're pregnant? I have never in my life looked at somebody and said anything. Although I can tell, I would never utter out of my mouth like, oh my gosh, are you pregnant? Ooh, no, that's a big no-no. But comment down below if you think it's rude to ask women if they're pregnant. For you, mom, a possible symptom this week that may happen are leg cramps. The uterus expanding can now start to put pressure on certain blood vessels, which can cause leg cramps. Drink water. Drink a lot of water. That can usually help with leg cramps. And also, because of that pressure on those blood vessels, you can also develop something called varicose veins as well. So try propping up your legs, exercising, avoid sitting and standing for a very long time. So just make sure that you're moving around and you're not in one position. That can help with those varicose veins. Week 19, your baby is about the size of a mango. Baby can be up to 7 inches long now and up to 8.5 ounces. This week, baby is actually now starting to form their adult teeth. It's going to be obviously, inside of the gums, right? It doesn't come out until they are born, but they are starting to form inside those gums. So amazing how a lot of our organs and our developments are quite literally made before we are born. God is amazing. Every single time that I get deeper and deeper into the medical field and I read all of these things and I learn about these things, it just makes me marvel at how everything was planned so beautifully. So beautifully how everything is planned. I am just in awe of God. For you, mom, you may now start to develop something called round ligaments pain. Now, so many different things can be causing this, right? So pressure from the uterus expanding, the pregnancy hormonal changes because of progesterone, it just pretty much just makes those smooth muscles relax, which can cause like a dull, achy pain. Now, some of the things that you can do for this is resting, right? Making sure that you are changing positions from standing to sitting, stretches, that you are stretching out and you're kind of helping those ligaments, that area out, okay? Be very careful while you're stretching because you don't want to overstretch and cause issues. Week 20, mom, you are halfway there. Halfway there. Week 20. So exciting. This week, your baby is about the size of a banana. Your pregnancy is at the belly button. Week 20 is usually the time where you can get a detailed anatomy scan. You'll see baby's organs, limbs, and definitely can find out the sex of the baby if you desire. Now, another big one this week is you should start to actually feel more flutters and actually feel more movements this week. And for you, mom, you may start to have a little bit of shortness of breath because of that uterus expanding. So don't push yourself too hard and rest when you can. Week 21, and your baby is about the size of an endive. Baby is about 8.5 inches head to toe and weighing at about 12 ounces. Baby is now developing routine, meaning baby is actually sleeping for a certain amount of time and awake for a certain amount of time. A big one this week is baby's bone marrow is beginning to produce red blood cells. So you, mom, make sure that you're loading up on those iron-rich foods, your lentils, your greens, and if your hemoglobin is less than 10.5, you actually do need to take iron supplements. Don't worry, most of us moms have to take iron supplements. Iron supplements can cause a little bit of constipation, so make sure you're drinking a lot of water, a lot more water than before. Possible symptoms that may develop this week is leaky breasts, okay? The milk ducts are already prepping for the big day, so don't be surprised if you start to leak a little. And dry, itchy skin. Because your skin is stretching, you may now start to have those dry, itchy stomach. Load up on shea butter. I'm going to link below my go-to shea butter. Shea butter is great for dry, itchy skin, and it's also great to help prevent stretch marks because when your skin is stretching, what can happen? Stretches and then causes a stretch mark. So make sure that you are lathering on moisturizer. Week 22, and your baby is now the size of a coconut. Your baby is about a full pound and nearly 11 inches long. Oh my goodness. Baby's eyes are now fully formed, although they are closed still. Baby's muscles are stronger, so you may start to actually feel a lot more kicks. Every week from here on out, your kicks are going to get stronger and stronger, and it's going to feel a lot more real. They have a sleeping cycle now, so they may be sleeping when you're awake or they may be sleeping when you're asleep. For you, mom, you may start to notice a dark line called linea nigra. It is the line that is literally in between your stomach. It is caused by hormonal changes. Don't you worry, it is going to go away once baby is out. Week 23, your baby is about the size of a grapefruit. Woo! Baby is just over a pound and nearly a foot long. Baby is less transparent, so the fat is forming in their body, so they're actually now starting to form fat and looking less see-through. Baby's lungs are maturing a lot more, although they're not yet ready for the outside world. Baby's hearing are actually more fine-tuned now. They're actually able to get startled by noise. Continue to sing to baby, continue to play music, talk to baby. Their hearing is actually now a lot more mature to be able to recognize certain things. For you, mom, you may start to develop something called Braxton Hicks contractions. They are not real contractions. Some say that these happen just as your uterus way of preparing for the real big day. Now, if it ever gets painful, intense, and continuous, then you definitely need to head to your doctor. They are usually harmless, okay? They're just a tightening of the belly. They should not be painful. They should not be regular. They should actually not be consistent at all, especially during this phase. Week 24, your baby is as long as an ear of corn, weighing around 1.3 pounds and gaining more fat every day. Baby's lungs are producing a surfactant, which is a very important substance that pretty much helps baby breathe outside. And for you, mom, your uterus is about the size of a soccer ball. So you may notice a bigger pregnancy belly. You might notice that your belly button is coming out. Hello, Audi. Oh, and heads up, this is the week that you're probably going to do your gestational diabetes test. So this is when you're going to take that sugary drink, okay? And then we're going to test to see if your blood sugar is too high. Don't you worry, mom. If your results are abnormal, there are steps that we take to keep you and baby safe. Just make sure that you get tested for gestational diabetes. Week 25, your baby is about the size of a cauliflower, almost 1.5 pounds and almost 14 inches long. Baby is having more hiccups, and you may actually now start to feel those rhythmic movements. Those are actually hiccups. And baby's hands are fully formed, so they're exploring their face, they're exploring all over. They may even try to grab the umbilical cord. And for you, mom, heartburn and indigestion can actually start to happen right now. So try eating smaller foods. Try to avoid things like spicy food, even chocolate, okay? And also don't eat too close to bedtime and drink a lot of water. Hydration is always the best for you and baby, and hydration really does help with a lot of these symptoms. Week 26, mom, and your baby is about the size of a scallion, as long as a scallion. So baby is about 14 inches long and closing in on 2 pounds. This week is about the baby's immune system. Baby's immune system is preparing for the outside world. And then also this week, their eyes may actually now start to open. And for you, mom, a possible symptom this week is swelling. You may now start to have swelling in your ankles, but you really want to make sure that you're checking in with your doctor because there's something called preeclampsia, and swelling is one of the symptoms of preeclampsia. So you want to watch out and monitor for any excess swelling so that we can double check and rule out preeclampsia. But a little bit of swelling is completely normal and expected in pregnancy. Remember, there is an increase of blood and fluid volume in pregnancy of up to 50% to pretty much support baby, right? So a little bit of swelling is normal, but when it becomes too much, which you may not know when that is, you always want to make sure that you talk to your prenatal care provider about, okay? You just bring it to them. I advise that every mother should have a pregnancy journal. Very important for you to have a pregnancy journal because of that pregnancy brain as well. You tend to forget things. You want to write things down that happen during the times when you don't have your appointments so that when you get to the appointments, you can quickly just tell your doctor, this is what's going on with me. This is what's happened. Which one of this is normal? Which one of these do we need to pay closer attention to? Week 27. This is the end of the second trimester, mom. You made it. You made it. So exciting. Your baby is about the size of a head of lettuce, about 14.5 inches long and 2 pounds. A big one this week is the baby's brain is more active than ever. Baby's lungs are not fully mature yet, but they're already practicing breathing motion. So they're practicing that already. You might also notice stronger kicks because baby is getting bigger and you're able to feel baby a little bit stronger now. Baby is also now possibly able to recognize that it's your voice versus daddy's voice. And for you, mom, during this end of trimester, hemorrhoids might start to appear. Make sure you're eating a lot of fiber and drinking a lot of water. During this whole pregnancy, the biggest thing that I need you to do for me is get one of these. Get yourself one of these water bottles, take it everywhere, just munch on it, not munch on it, just sip on it. Another big thing is I know that you have to pee a lot and then you also need to drink water. I understand that it sucks and it's hard, but the thing that kept me going during my pregnancy is it's not going to be forever. It's not going to be forever. It's temporary, right? And everything will go back to normal. But again, make this your best friend, all right? A lot of the symptoms of second trimester are pretty much related to a growing baby, a growing uterus, putting pressure on your ligaments, which is causing pain, putting pressure on your lungs, which is causing shortness of breath, okay? So do a lot of resting, okay? Just switching positions. And I do advise if it's one thing besides the water bottle for you to get, you should definitely get pregnancy pillow. You're going to need it, especially for the third trimester when sleeping becomes a little bit more uncomfortable. Your baby grew a lot during this trimester. Baby's brain, baby's lungs, baby's hearing, especially. There was a lot of senses that the baby was developing, right? So this trimester was very vital for baby's growth. Every symptom, every change that you're going through is simply because of that little bundle of joy growing in you. It's all a part of the journey, and you're doing amazing. You've got this, Mom. I'm cheering you on for the third trimester. Woohoo! We made it through the second trimester. Don't forget to subscribe, Mom. I'll see you next week as we dive into the third trimester. Bye.